So prior to the procedure, we have to wash our hands. This is before and after handling the patient. It is important to deter the spread of microorganisms. So next is, after washing the hands, we have to explain the procedure to the patient. This is to build trust and for the patient to cooperate well. So, hello ma'am, good morning.
Hello, good morning.
I am Lola Esantises, a student nurse from Davao Doctors College. And may I know your name, ma'am?
My name is Maureen Smith.
So, Ma'am Maureen Smith, hello, good morning again. Today, I will be performing on Leopold's maneuver. Leopold's maneuver is used to know the position and the presentation of the baby during labor. So, during the assessment, I will be palpating your abdomen using gently but depressed palpation. So, inform me if there is any pain that you felt, okay? And then, prior to the procedure proper, I'll ask you to empty your bladder. This is for you to be comfortable, and also having a distended bladder would deviate the uterus. So come back after you urinate. Okay. So next, after, are you done with your emptying the bladder now?
Yes.
Okay. We have to position you in a supine with one pillow under her head and with knees slightly flexed. And drape the patient for privacy. Exposing only the area where we will be examining. Also, we will be putting rolled towel under your right hip, ma'am, to prevent supine hypotensive syndrome. Okay. Then, supine position would be helpful to facilitate accurate assessment and provide comfort. Also, the flexed knees would relieve tension of the abdominal musculature. Then, we have to close the door and the curtains. This is to provide the client's privacy. So next is, I'll be standing here on the right side facing the patient since I am right-handed, for me to be easily grasp the symphysis pubis that to be done on the third maneuver. So prior to the maneuver, I have to rub my hands first to keep it warm, to prevent the tensing of the muscles. So first maneuver would be the fundal grip. So the first maneuver is the fundal grip. So we have to face the patient and palpate the uterine fundus. This is for us to determine what part of the uterus, what part of the fetus lies in the upper part of the uterus. So this is for us to determine whether it is a fetal head or a breech. So if it is the head, it would feel like round and firm and moves independently on the body. But if it is the extremities or it would feel like the nodular and it is less well defined, that moves only in the conjunction with the body. So in this case, it has nodular. It feels like it has nodular and is less well defined. No, it is as a the second one is the umbilical drip, where I'll be placing my hands on the side of the abdomen and palpate gently but deep pressure to determine the position of the fetal extremities, the fetal back, and the anterior shoulder. So in palpating, I have to steady the other hand of my other hand in one side, and the other hand would explore the other side. So in this side, no, there is feel that I feel that it is smooth, hard, and resistant surface which has a long continuous structure. And on the other side, so let the other side steady. It has a irregular mobile, which is the fetal extremities. No, it has fetus is a number of it feels it has a number of angular nodulation. So it is in here, in this side, the fetal back, and it is in this side the extremities of the fetus. So next is I'll be performing the pollex grip, which is I'll be placing one hand over the symphysis pubis and grasp the lower uterine segment between the thumb and the fingers to feel the presenting part. So, and aside from determining the presenting part, it is also in here that will determine if it is already engaged. Since the presenting part is not movable, then it is already engaged. But if it is not engaged, it is like floating, it is still movable pa. But in this case, it is not movable. Yeah, so this is already engaged. So I'll be on the last maneuver, which is the fourth maneuver, the pelvic grip. I'll turn my face on the woman's feet to confirm that the findings of the third maneuver, to confirm the finding of the third maneuver and determine the flexion of the vertex. So, here. So, as I palpate, the brow corresponds to the side that contains the elbow and the knees. So, this suggests that the head is already flexed. So, this is the head. This corresponds to the brow, to the knees. So, it's already flexed. So now we have to locate again the back to get the fetal heart tone. So since the baby is in a cephalic presentation, no, the fetal heart tone can be heard in the lower quadrant of the abdomen, either on the left or on the right. Since we already know in the maneuver that the baby's fetal back is in the in the right side, and thus it is heard here in the lower quadrant of the abdomen. So put here. So we will record the fetal heart tone in 1 full minute. So as we record the fetal heart tone, we have to note the rate, the characteristics of it. So the fetal heart tone of the baby in 1 full minute is 140 beats per minute, which is it is in the normal range, no, of a fetal heart tone of 120 to 160 beats per minute. After the assessment, we have to make the patient comfortable to promote relaxation, as well as we have to thank the patient for her cooperation, and also explain to the patient the findings. Third is we have to document the observation made, the fetal presentation, the attitude, and the flexion, or it is already engaged. No. Also, the purpose of this is to promote database for future, and also since documentation is a legal matter, so it is very important to document all the observation made. Based on my assessment, as I observed, there is a linea nigra and a striae gravidarum on the patient's abdomen, which is normal since she is pregnant. And as I palpate, the baby is in a cephalic presentation. The attitude is flexed and it is already engaged. The fetal heart tone is 140 beats per minute within the normal range of the fetal heart tone, which is 120 to 160 beats per minute. And thank you.